My name's Louise Maple-Brown. I'm the head of our Diabetes Across the Lifecourse Northern Australian Partnership, which is based out of Menzies School of Health Research in Darwin and across the north of Australia. I'd like to start by acknowledging the Arrernte people as the traditional owners on the land in which we meet today and pay my respects to their elders, past, present and future, and extend that respect to all Aboriginal and Torres Strait Islander people in the room today. It's so wonderful to have all of you here today and to see so many faces. It's fantastic. Thank you all for attending and for your enthusiasm in participating in today. It's going to be a fantastic day. Our welcome to country is a little bit later in the morning due to the availability of the group that we're privileged to have welcoming us this morning. I'd like to say that this is our 11th annual Diabetes Across the Lifecourse Educational Symposium, and it's very exciting that this is also our first Northern Territory Diabetes Summit. And we've joined together with partners from NT Health, Commonwealth Government, NT Primary Health Network, and Aboriginal Medical Service Alliance of the Northern Territory. So thank you very much to all the partners for contributing to today and tomorrow, and it's going to be a fantastic couple of days. We do also have some attendees online, so I'd like to acknowledge them as well. I think we have over 150, quite likely more, online. For those online, if you wish to offer a comment or a question, please use the chat function. We have people from our team monitoring the chat function and can contribute those questions to the question session in the room, which will be happening at the end of this session this morning. Also, we'd like to keep this event as COVID safe as possible, so please do help yourself to masks outside. And if anyone is feeling unwell, Congress have also generously provided RAT tests, so please do utilise them as required, and please leave if you're feeling unwell or do not attend. So I'd first of all like to welcome our first speaker, Associate Professor Marco Briceno. Marco is the Acting Chief Executive of NT Health. He's an outstanding rural generalist who has spent 14 years in Nhulunbuy as a rural generalist and is very familiar to the Territory and well known to all of us. Marco was very appropriately recently acknowledged with a Distinguished Service Medal from the Australian College of Rural and Remote Medicine. So congratulations, Marco, on that achievement. That's wonderful.
Thank you for that introduction, Louise. And I would also like to acknowledge the traditional owners of the land in where we're all meeting today and pay my respects to the Arrernte elders, past, present, and emerging, and also extend that acknowledgement and that respect to any Aboriginal person in the room meeting with us today. I'm very pleased, I'm very honored to be here today opening the 2022 NT Diabetes Summit here in Alice Springs. I would also like to acknowledge the partners that are putting this together. I think it's an important function that we're all here, and to see so many familiar faces and so many people that work arduously in this space is important for us to join forces. All these partners, as Louise mentioned, Northern Territory Health, Menzies, AMSANT, NTPHN, and the Australian Government Department of Health are our partners. I wanted to do a bit of a reflection and talk a little bit about why we are here. And I think we all know that, but I think it's important to set the scene as to what we want to talk about. So type 2 diabetes epidemic among First Nation Australians here in the NT is alarming, as we all know, and it requires our urgent attention, and not only from government and non-government organizations like we are here and agencies, but also from our communities. The social and cultural determinants of health contribute to the epidemic significantly, and this epidemic is intergenerational in nature. So it's quite significant what we are all trying to deal with here. And I guess give you some data and some numbers. One in three people, Aboriginal people living in remote Northern Territory are living with diabetes. I'll just say that again, it's 1 in 3 adults out of communities have diabetes. That is at least 5 times higher than the comparison with the rest of the general Australian population. And this number, as alarming as it is, underestimates the impact that we actually see in diabetes among young people when the rates are 20 times higher compared to the rest of the Australian population. Another important sort of set to consider is that diabetes in remote NT has doubled in the last 15 years. So we have twice as many diabetics now in our communities that we had 15 years ago. And you could look at this from different angles. It could be that we're getting better at diagnosing them, and we're getting better and finding out diabetes early. But at the same time, we're probably failing to prevent it. And that's one of the reasons we're going to be talking here today. How do we tackle this growing epidemic? Another sort of alarming number is that the new onset of diabetes is peaking at a much younger age in our population. Diabetes is peaking around 30 to 50 years, when in the general population peaks between 60 and 80. So diabetes is not only affecting our communities more aggressively, it's affecting our people at an early stage. And people are living with diabetes for longer, and we're living with the consequences of diabetes as a result of that. Recent work from Menzies reported rates of diabetes here in Central Australia, Aboriginal people, that are some of the highest in the world. We compare when we talk about diabetes in pregnancy and diabetes in young people, and that's people under 25 years of age. The purpose of this summit is to bring government and non-government agencies to discuss actionable, tactical, and scalable solutions to address the social and cultural determinants of health challenges and achieve better health outcomes for the vulnerable population who is affected by type 2 diabetes here in the Northern Territory. Today's program will be led by Aboriginal and Torres Strait Islander Advisory Group at Menzies, Diabetes Across the Lifecourse Partnership, and brings community members and health professionals together to discuss clinical issues related to type 2 diabetes. Actions and measures will be identified for the next 12 months, for the next 5 years, and for the next 10 years. We need a plan for now, but we need to have a long-term vision. We need to address what we're dealing with today, but we need to have a plan as to where we'll be in 5 years, where we'll be in 10 years. We must win this war. I wanted to end with a bit of a positive note and a note of hope, perhaps. Even though we see more diabetes, and even though these numbers are alarming, and this war is not over, we have won many battles along the tracks in recent years. And I'll talk about my personal experience in Nhulunbuy, where I spent 14 years of my medical career. When I first went to Nhulunbuy 14 years ago, we were seeing a lot more amputations related to diabetes, a lot more heart attacks related to diabetes than I saw when I left recently, just less than a year ago. So we're getting better at controlling diabetes, we're getting better at diagnosing it, but we're still just covering the tip of the iceberg in a way, and we're getting more and more diabetes. We are learning that people are getting it earlier. We're learning that people are getting in pregnancy, and there is an intergenerational component to it. So, as I said before, even though there is hope, and the work that we're all doing is not in vain, and is actually showing some results, this war is not over, and that's why we're all here today. Day 2 tomorrow will talk about the social and cultural determinants impact in type 2 diabetes, and that's an important aspect. So diabetes is not only a medical issue. We doctors and nurses can only do so much, but it's a lot that needs to be done to address the social determinants, and it's a lot we need to do with regards to education of our communities and empowering people to help us on this battle. So on behalf of NT Health of the partners, I would like to thank everyone for attending. It's very exciting to be here. And I will really look forward to hearing the panel members, the discussions, the consumers, the chats that are going to be happening around, and what's going to happen after that. So welcome everyone, and thank you for being here.
We'll now have the welcome to country. Thank you.
What everyone? Mara. Ya kal mara. Lag na tor ti garun na tor la pati meeting. Ano na gan itlar mala. Diabetes. Ano na gan mabang kona toran mer. Anyway, Arrernte na kumuli ngarai. Yang Arrernte. Yang pachiga Arrernte ni pachiga manon kanun. Arrernte ko na pachiga. Mara ban ni korenjala. lagana podi rejek, garajek. Takana karuna no nagai to ma painda rejek. Come here to welcome you all. You come many miles from many communities, all the countrymen, get together to talk and to support each other in this very crucial time, because a lot of our people are coming down with diabetes. Not very nice, very good. Diabetes our elders in the past, they were healthy. They walked the land. They chased kangaroos and goannas, and they walked for the next to get their next meal. But today we go for junk food. KFC there, McDonald's there. Everything's out here now, and I think a lot of that changes are, affecting a lot of our young people too. And diabetic. And back to the welcome, and welcome to you all on behalf of our elders, past, present, and future. And they would get together here before this building came, before colonization, going back in time. Our people gathered here and sang and danced and told stories, passed it on to the teachers, to the next elders, and educated them about their roles and responsibilities of who you are and your roles and responsibility for your people, kinship, and connects us to the land, to our dreaming, our songs and dances. That makes us that much stronger. And they would sing and dance right around Mparntwe, right around Alice Springs. Alice Springs is built on sacred land, sovereign land of the Arrernte people. And, that was the purpose of educating our mob. Be the next leaders, and you are the next leaders too. When you look at the same format and same way of educating each other, working together, educating one another, working collaboratively together, and also, just forgetting that we do have a lot of differences in our cultures with the people that we work with, but we have to balance our culture and our traditional ways of healing practices, and ngangras, doctors, balance them. We can't have just health for our people. Just can't have this. The Western system deal with and researching our people all the time. We got researchers, we got ngangras, we got people that from the ground up to come and balance that, and you can do that, all our countrymen, and you can you together can make it happen, and to sort out the problems that we have in our health today in this era, the 21st century. Hasn't gone any better, it's gone backwards, got worse, with the new changes in our diet, new changes in our lifestyle. We just got chucked in a blender, whisked it around, and just threw it out there. Where are we in the next era? And then we got to all balance that and incorporate what we got and what you got, incorporate. There are gaps in health that needs to recognize and acknowledge how ngangras and how traditional healings and traditional medicines and traditional foods got to come back. And it's this is not the big issue amongst our people, and you and you alone, our countrymen, can do that. And you alone can work together with your co-workers and strive and struggle hard to get, in some way, I don't know where the diabetic business comes from, but maybe you know better than I do, that where and how it affected our people. So we're on a big journey, we're on a big mission. So just make sure that you stay in the countrymen and make sure that things I'm going to, settle down maybe, I don't know when, but health is a big issue now. And it's great to see that a lot of our countrymen are here. Welcome, everyone. And also bear in mind that you're here for the one purpose, to make our health better than ever before. And researching, but we have our research already implemented, so you need to bring that out. COVID was another issue, COVID-19, and we were all frightened and scared. But it's the same way with diabetes and heart conditions, and tabarga kidney, tabarga heart, and koranga brains, alkanga, eyes. It all affects that health that can affect everything in our chirjal, in our body. Well, anyway, I'm great and welcome again on behalf of our elders. Kala?
Thank you very much, Auntie, for that beautiful welcome to Arrernte country. We do also have some dancers as part of the welcome, and they are currently getting ready, so we'll be performing after the next speaker. So I'd like to introduce Nathan Billary Garrawurra as our next speaker. Nathan is from Gallawinku in northeast Arnhem Land. He's an Aboriginal health practitioner with MeWatch, and is speaking his own personal journey and story today, and his commitment to Gapu for wellness. So thank you very much, Nathan. Nathan will be talking together with Sian Graham, who is chair of our Aboriginal and Torres Strait Islander Advisory Group of our Diabetes Across the Lifecourse partnership. Sian's based at Menzies, and Sian has led the program for today together with the Aboriginal and Torres Strait Islander Advisory Group, and I'd like to extend a huge thanks and welcome to Sian as well. Thank you.
Hello. They're on? Can you hear me? Good morning, everyone. Lovely to see all your beautiful faces. I think it's an incredible privilege for us to be here today and to have all our lived experience speakers here, and I hope you enjoy our day today. So I might just hand straight over to Nathan. Nathan, do you want to just tell us a little bit about yourself?
Yeah, firstly, I'd like to acknowledge the Arrernte traditional owners of the place we've met today. Acknowledging yang bala bilkal ngara dalwang or yang bala pokok ngala permirinyolang Arrernte mala.
So Nathan, do you want to just tell us a bit about where you're from, what community, and what you do for work?
Yeah, I'm originally from Gallawurra, Elko Island, and I have worked for MeWatch for the last 6.5 years now. So, yep, I live in Darwin and work for MeWatch.
And so, Nathan, do you want to just tell us a little bit about your identity and, about your community life and where you've come from and, why is your identity important to you?
Well, as we all know that there is a, huge disadvantage and, struggle amongst communities. And I grew up in that situation, environment. So I grew up in the epicenter of what we're gathering today. And that is the struggle people face. day to day, every month, every year. So this is an ongoing issue. So I basically grew up around people that were unwell. You can name it, heart, diabetes, different health problems. So for me, growing up, seeing those was very devastating and sad. And it's the other motivating for me to take this journey through health, learning health.
And so do you want to just talk a little bit about your identity and, your culture and tradition and why that's important to you and how that's, transformed you in your journey, like where you are today?
Yeah, as many young people, young Aboriginal people, whether they're men, women, young boys or girls, they struggle with who they are. And, it's a difficult journey for them. I think what I did is I've embraced who I am as a person, as a young man. And that is part of me. That's, we say, is in our DNA. Yeah? That's our identity. That's who we are. So I want to empower the next generations to be themselves, who they are, and embrace themselves, embrace their culture, and take that with them to the future.
So what keeps you strong as an Aboriginal man?
I think family, as you can see. I'm a family man, and the kids makes me stronger to do more for my kids. So I'm breaking the generational trauma here. I am being the example how you can lead your family. If you're better leading your family, then you're better leading your community and your people. But it starts with you, from within you.
So what are some of the issues and barriers of being an Aboriginal man?
I think lack of education is one of them. And I think there's a lot of factors in young Aboriginal men, especially, of finding that strength, how to move forward, how to take on those responsibilities, how to be a father, how to be a husband. They have to know what direction they are heading. Right now, we can all see it every day. There's Aboriginal men in the news for all the wrong reasons. So I want to see more young men, boys and men, take on those responsibilities and those roles of how do you be good example, good role models for your family and for other people as well.
So what were some of the issues that you faced in the past living out in community?
I think lack of employment, lack of training, and lack of housing. I was living just like everybody else, with other families. So living with other 20 people in the 3-bedroom house. That was an issue for me, and well as for my family. My wife and 3 kids, we have to share things, with others, and that was not good. And, living especially in remote communities, it's hard. And there are certain, support in there, but it has to come from you. You have to know what direction you're heading. You can't just wander around with no direction. That's what happened to me when I faced those barriers and struggles living in the remote communities. My hometown of Garrawurra, Elko Island.
So what changes did you make?
Well, I focused, a lot of my work and effort started with me. I knew I didn't want to depend on people to get to where I am here speaking to you. That comes back to you. You have a choice in life, whether you're going to live just like everybody else or you're going to change. That comes, I started working on myself. How do I improve myself? Not what others want me, my direction. How do I find that direction? Myself. I need to work on myself. I need to improve myself. If I can do that more, my family can be better off. If I'm working, taking responsibilities, taking charge of my wife and kids, setting a good example, working, eating well, drinking water, everything like that, that shows my family to live how I live. That's a good role modeling you're doing on your family.
So who has diabetes in your family?
Unfortunately, my wife has, which is the hard for me, especially because my wife has type 2 diabetes. And that's due to, consumption of a lot of bad things, takeaway food, soft drinks, and, and I didn't want to stop or tell her what to do because, she's the boss. I can't tell her what to do.
Good man. So just thinking about like services that have been delivered in your community, like what's your perspective on that?
I appreciate a lot of programs that are carried out in the communities, and it's hard getting people in those programs to join and help improve themselves. And it's been a some people it's a roller coaster, because they have a lot of issues, they have a lot of other that gets carried away on their mind. So what I want to do is I want to show people to take responsibility for themselves. Start taking learning and understanding what they can do. They can be better, but it takes a lot of work to be better and effort to work hard to change your life. And this is a hard part because you are talking to the people that are surviving on a daily basis. And I want to try to turn that into thriving than surviving, because they have to learn and understand themselves. What do they want to do for the next 10, 20 years' time? And it's not a big, it's just the small steps they can take by doing things right way in their house, participating in a good environment, learning and understanding their culture as well. That's a wellness journey as well. So culture is important, I think.
So where to now? What's your plans for the future? Where do you see yourself?
I want to I wanna pursue something that, I wanna give back to the communities. Because you don't see a lot of young Aboriginal men in the health sector, especially, young men and young women, they don't prioritize health as their number one, journey, or, they wanna take, and I wanna help them understand about themselves, Kapo is water. Our body is made up like 80% of our body, eh? So Kapo is important. You gotta learn who Kapo is you. Kapo connects you back to the land. So what you see in the land is just a reflection of yourself. So the land holds Kapo. And where's the Kapo? Is in the body. Body is the land. And the Kapo connects it back to the land. And that you can see in the paintings, in songs, in ceremonies. What we do, all connects back to the land. If you don't want to frack, you don't want to mine your land, but you're doing it already here. You're fracking it, you're mining it. So you need to take your health responsibility. Importantly, your health's got to be your priority. You look after your land, but look after your body, because body is the land.
Well, I think on that note, we'll leave it there. Thanks so much, Nathan.
Thank you very much, Nathan and Sian. We'll be saving questions for the speakers to a panel session at the end of the session this morning, so please keep all your questions front of mind and post them on the chat if you're online, and we'll have sessions for all speakers together at the end. I'd now like to welcome Donna Chee as our keynote speaker for this morning's session. Donna is a Bundjalung woman from far north coast of New South Wales who's lived here for over 30 years in Alice Springs. Donna is well known to all of you, I'm sure, as the CEO of Central Australian Aboriginal Congress and as director on the board of AMSANT and the Batchelor Institute. She also has many other roles, and we look forward to welcoming and hearing your presentation this morning, Donna. Thank you.
Thank you, Louise. And I'd just like to acknowledge the beautiful warm welcome from Arnie Kumali Riley this morning. And I'll tell you what a hard act to follow, Nathan. I thoroughly enjoyed your sharing your story, and I think what's really important is that what you've been able to do is highlight the importance of, responsibility and getting that balance with responsibility with the sort of structures that make people sick. So I really want to thank you for that, and I like I said, I just thoroughly enjoyed it. So I'd like to thank the organisers as well for this important conference, for inviting me to speak today. As Louise said, my name's Donna Chee, and I am a proud Bundjalung woman from the far north coast of New South Wales, but I have been living on beautiful central Arrernte country for over 30 years, and my 3 children grew up here. I'm speaking to you as the CEO of Central Australian Aboriginal Congress, an Aboriginal community-controlled primary healthcare service that's been around for next year, it'll be 50 years old. So we are based in Alice Springs, and we deliver primary healthcare through 7 clinics across the urban area of Alice Springs and in 6 remote locations in Central Australia. Since our establishment in 1973, we've developed a comprehensive model of primary healthcare, delivering evidence-informed services on a foundation of being culturally responsive. I'm sorry, Our comprehensive approach is based on 3 interlinked strategies: multidisciplinary clinical care, health promotion and disease prevention, and action on the social, cultural, economic and political determinants of health. Today I want to outline how these strategies apply to preventing and treating diabetes in the Aboriginal communities in which we serve. First, though, I'd like to briefly outline the dimensions of the problem. We have to start with the process of colonisation. In traditional times, our access to the land and its resources and a mobile hunter-gathering way of life guaranteed a good diet and an active lifestyle. And Aunty Kumali mentioned that this morning. I think we can be confident that diabetes was very rare, if not unknown. However, today the past and ongoing effects of colonisation challenge the capacity of many Aboriginal families to live healthy lives. Today we are facing high and increasing rates of diabetes in the Aboriginal community. The excellent study done by Dr. Matthew Hare and others shows that 40% of adults in Central Australia and 24% in the top end have diabetes. These are staggering and deeply worrying numbers, just about the highest ever reported for any population in the world, ever. But as this graph from this study shows, it is worse than that. Diabetes prevalence in remote communities is increasing by about 2.5% per year. However, there is a positive story as well. The past 2 decades have been significantly better management of diabetes in primary health care. These interventions have been successful in preventing the most serious results of the disease. Between 2006 and 2018, mortality rate for diabetes for Aboriginal and Torres Strait Islander people decreased from 93 to 72 per 100,000. Life expectancy for Aboriginal men and women also increased very significantly, but the burden on our health services is enormous. As practitioners or managers of health services, we know that when around 1/3 of our clients have diabetes, along with other complex chronic conditions, it is very resource intensive. This is at a time when we are facing critical workforce shortages. So how do we get off the slippery slope we seem to be on of rising rates of diabetes, which our services are struggling to contain and manage? How do we envisage a future where our people can be free from the ill health, disability and sorrow that diabetes causes? I want to share with you 8 strategies that are part of our comprehensive primary healthcare approach at Congress. Taken together, they form a package that, if replicated, sorry, I've got a muck up in my slides here. Taken together, they form a package that, if replicated and resourced widely, could reverse some of the trends we are seeing. First, we need to address, I'm sorry, I think I've got, no, it's right. I've just got an actual slide missing for some reason. Anyway, that's okay, we'll stick with this. The message is what's important. So first we need to address some of the social and political drivers of diabetes by reducing poverty and inequality, addressing food security and reducing alcohol availability through population level interventions. Second, we need to invest in primary prevention by reducing low birth weight and by ensuring children grow up with all the factors in place to ensure healthy early childhood development. Third, we need a primary healthcare system that is well resourced to intervene early for those at risk of developing diabetes and provide quality disciplinary management of disease. We can also look ahead to some promising new approaches to reversing diabetes through weight loss. I'd like to describe each of these 8 approaches briefly.